All right. So, Kalsey, what prompted you to actually initially apply to the Allergist Foundation for the community grant?
So when I attended conferences over the last couple of years, I think there's been a trend that we are starting to notice there are a lot of barriers that food allergic children who are from Black or Hispanic or low socioeconomic status families are facing, which is really a crisis, I think, in our field, and something that I've felt very passionate about. I think we're doing a good job at identifying some of these barriers, but not necessarily where they're coming from. And my passion for trying to figure out and address these barriers, as well as collaborating with schools, really kind of triggered my application process.
So, what have you learned so far? I know you've had some delays, but what have you learned so far? Has anything surprised you?
Yeah, I think that there's a handful of things. So one of the biggest things we found is the lack of standardization. So essentially coming into a lot of these Head Start programs, we have found that there's huge variability. So some of the programs have a dietitian to help them navigate food allergies. Some of them are hands-on with most of them provide food for the children there. And so some of them are hands-on in the food prep. Some of them are getting food delivered to the classroom with no labels or anything on them. Some of them, all of them are required to do epinephrine training, but there's not necessarily standardization on what epinephrine training is or any food allergy education awareness, whether they are nut-free or not. And I think the hardest part when you try to implement change is if there's such a variability, how do you navigate those differences? But I would say one of the great aspects of that is that each program has kind of figured out ways to fill in the gaps. So how do they try to make sure they prevent severe reaction from occurring? And I think their feedback has been great, because then you can start to implement some of these across the board to other programs as well that they might not have thought of. The other big barrier that we have come across is the issue with stock epinephrine. So one of our goals was to make sure that there was access to stock epinephrine, particularly in these age groups, because they may have undiagnosed food allergies. For many of these children, they might be having the first exposure while they are at school. And Connecticut is fortunate enough that in the last couple of years, they passed Public Act 1919, which allows stock epinephrine for distinct entities within Connecticut. But unfortunately, despite a lot of work with the government and our senators, they are now saying that early childhood centers are the exception to these stock epinephrine rules. So it is a lot of advocating that I did not anticipate, and how frustrating that can be when you feel in your heart what you're providing for is evidence-based and the laws are telling you otherwise.
So when you get done with all this, we'll actually make a position for you in the Advocacy Council, because you'll have a lot of experience on that too.
That sounds lovely.
But yeah, an unintended consequence. You're learning that, things aren't as easy as going from A to B to C.
Yep.
You have to actually kind of roll with some of the changes. So you're doing a planning grant, but are rolling it into an implementation. But what would you see as the benefit for the community allergist from your study?
So I think it's integral that we work as community allergists to get involved in the community. I think one thing that we have found out is that a lot of these kids, don't have access to an allergist. And that is huge, because they're going into a school setting where they are required to say, these are the reactions I have to these specific foods, and here's how we plan to treat them. And I think for families, and even for many pediatricians, that's very hard to distinguish what's an allergy versus an intolerance versus a dislike. And so I think allergists need to make sure that we are ensuring everyone has access to us, and collaborating with the pediatrician. Perhaps we aren't able to see every single one of these patients, but part of what we're looking to do with the implementation aspect is to collaborate with the pediatricians, perhaps be able to provide some standardized education so they can stay up to date. Things are changing so fast in the allergy world that I think it's very hard for a pediatrician who has so many realms to navigate to figure out how to do that. And I think being able to work with the pediatricians, being able to work with the schools and the families in the school setting is an important way to make sure that we're really providing collaborative care.
Mm-hmm. So maybe part of this in the future would be, once you get all this done and you're published in Annals, we've got a roadmap for other allergists to take.
Exactly. So we're really hoping to find some way, and that is an efficient way to standardize, particularly working with this population that could be applied across the country and be able to be used by other community allergists to implement in their states as well.
Well, and you identified a need right away in that, your advocacy efforts have shown that when people say school, they don't necessarily mean early school, Head Start, and preschool.
Absolutely.
I think a lot of us would say, oh yeah, it should.
Right.
I mean, why not? But oops, and so where's it going to go from there? So what hurdles have you come across that you didn't anticipate?
So one of the biggest one, I think, is the stock epinephrine, but some of the other ones have been staff turnover, right? So I think everyone is struggling with staff turnover, but especially these Head Start centers, they have staff turnover that is pretty quick. And so how do you, for some of them, they do all their epinephrine training in August before their session really kicks in. And so then when you have staff turnover, who's making sure that they get the appropriate education and takes the time to do that when you have high turnover rates? And when we're working on providing education, how much does that stick? If we do education once a year for the staff, is it something that needs to be done more frequently because the staff turnover is so quick? So that's perhaps one of the biggest hurdles. Another one is time. I think everyone's just short on time. And so finding a time that some of my centers have been phenomenal, and they will actually block an hour that the teachers are still getting paid for to attend education with us. So not only are the teachers getting paid for that hour of education, but then they are getting some of the gifts that we're able to provide them with as a token of gratitude. And I think that encourages attendance. And some of the centers simply can't afford to make that happen. And so it becomes trying to be flexible and make sure that you can work with the centers for what they're able to do.
Yeah. Well, maybe at the end of this, you're going to be able to produce something as a video. Like we have to watch it. Some of our centers, we have to do our continuous education, or our mandatory education. And, it'd be great if out of this, you could do something that the centers could utilize for a while. And
then they can use it at their convenience.
Right. And so, God, you're going to come up with some great ideas. This is going to be fantastic. Do you have any words of advice for anybody who wants to take this on?
I think the biggest piece of advice I would have is think about where you feel like there are holes that we're missing in our field, or things that never stop asking questions. Why am I doing this? Why do we make this approach? Is there something different that we should be thinking about? And as you ask those questions, think about what really inspires you. When you're working with patients and a patient asks you a question that you might not have the answer to, is it something that really inspires you? Or is there something really frustrating you're dealing with in trying to care for your patients? And perhaps there's something we can do differently. And I think as you find some of those passions, then you start to talk about them, and just talking about them with your colleagues, I think really brought about a lot of the collaborations that I currently have. If I hadn't talked to some of my mentors about where my passions were, I wouldn't have been connected with some of these other resources. And so I think it's okay when you find something you're passionate about to really let people know.
Yeah. Well, and I think you really speak to the fact that you look to your community and what were the needs in your community. And, our mantra for the community grant program for the Allergist Foundation is we really want to have these be things that give back to the practicing allergist. And I think yours is one of those programs that easily is going to, you've identified a need, you're basically studying it initially, you're looking at the barriers, you're overcoming those barriers. And then you're going to actually take it to that next step of implementing it. And I'm looking forward to those results. I mean, and the next step at the end of this in a year or so is going to be publishing it in annals and having other allergists be able to take this forward and say, hey, this was this great thing. I saw Dr. Kaman do this, and I watched that little video that she was in, and yeah, we could do this.
That's the goal, right? And that we all kind of build off of each other and work together to be able to, make a difference in the community that we're working in.